Welcome to Nursing 1067 video recording of practice question covering different topics in the nursing theory class. So today we are continuing with the nursing process and we have some case studies. So the first case study we have, Mr. X has a recent bowel surgery resulting in the application of a colostomy. Upon conversation, the patient stated, "This looks awful. I look gross." So before we start, first of all, what's a colostomy? So if we divide the word, ostomy is like opening, and colo is in the colon. So it's an opening like from the abdomen wall that collect the feces directly in a bag. And when you go for your placements, you will be seeing some of the patients who have this colostomy. And part of your routine care of the patient is to help the patient taking care of this colostomy and changing the appliance. So let's see the question. What is the actual diagnosis that can be applicable to this patient? So the priority one is about body image. So it's a disturbed body image related to the recent application of the colostomy, as evidenced by what the patient stated. So this looks awful, I look gross. So that's your as evidenced by. What can be a short-term and a long-term goal for this patient? A short-term goal could be a patient will assist the nurse in caring and changing the colostomy appliance by 5 to 8 days. So we said short term, this is something on the short run. And always the goal is about the patient, so it starts with patient will. And the long term, it could be patient will independently change the bag by 1 month, in 1 month's time. Or patient will develop positive body image by 1 month. So, so this colostomy, short-term one, yeah, the nurse can assist, but on the long run, because the patient will, some of these colostomy, the patient will live with them for long-term and almost for the rest of their life. So in some cases, so they will have to learn how to change and take care of this bag, because it's attached directly to the skin. So we are afraid of any irritation and infection to the opening of the opening and to the skin around the bag. So what can be some possible interventions to achieve this goal? So how can I achieve either short-term or long-term? So the intervention, this is about the nurse. What is the nurse will do? So the nurse will provide education and resources for the patient to care of the colostomy bag. Or the nurse will refer the patient to a appropriate healthcare professional for additional support. Or the nurse will assist the patient during change of ostomy appliance. So this could be for the short term. So she will assist in the beginning, and over the long term, he will do it by himself. Or another intervention, the nurse will actively listen to the patient concern related regarding the application of appliance. So it's very important to understand and listen to the patient, how he feels. This could be one of the intervention. And then always remember, guys, in the nursing process, we have to evaluate. So was these goals achieved or not? Was he on the long run within 1 month? Was he able to independently change the bag and take care of the skin around the opening independently, or no, needs further education or needs further assistance, and so on. Okay, next case study. So you have this nursing diagnosis, impaired swallowing related to the diagnosis of aspiration and pneumonia, as evidenced by patient had an episode of aspiration at home while having dinner, and is on minced diet. So this is a nursing diagnosis. So here is my diagnosis: impaired swallowing. And why we are saying this? Because he had this diagnosis of aspiration and pneumonia. So what would be a possible goal for this patient? So a possible goal will be the patient will resume regular diet without experiencing any episode of expiration within 3 to 5 days. And also, if you will see these patients, especially if your placement comes in a long-term care, very common to have pneumonia and problem with aspiration. So they have to be on men's diet. So this will be decided by the physician or the healthcare, and gradually they can be on regular diet if the condition improves. So what can be some possible interventions? So what can the nurse do? So in this case, the nurse can refer the patient to swallowing specialist. The nurse can or will position the patient in high Fowler during meals. And you see that it's very important, this high Fowler position, like sitting, like really sitting straight to avoid aspiration. And aspiration is when some of what the patient is eating can go into the respiratory tract. Also, the nurse will, another intervention could be the nurse will monitor the tongue movement, or the nurse will monitor pocketing of food during swallowing. So again, if your placement comes into a long-term care, and one of your duties is to supervise or even feed the patient if they're not able to do themselves. So it's very important to watch the movement of the tongue, make sure that the patient is swallowing properly and not pocketing the food. What does it mean pocketing the food? Like keeping the food in their mouth, like you will see it's not moving. So this also increases the risk for aspiration, and we don't want that. Okay, next case study. A patient in the long-term care facility is diagnosed with UTI on February 11. When the nurse was performing morning routine, the patient stated, "I feel burning sensation and my urine smells really awful." So what what is an actual nursing diagnosis that can be applicable to this patient? So it could be impaired. So here I talk about urine. So it could be impaired urinary elimination related to diagnosis of UTI on February 11, as evidenced by the patient stated, "I burning sensation and my urine smells awful." So what can be at-risk diagnosis for this patient? At risk. So here, guys, you have a long-term care. So he is probably the mobility or the movement is not that good. So it could be at risk for impaired skin integrity related to the diagnosis of UTI, because if he is mobility is impaired, along with he's sitting on bed all the time, along with he has some impairment and he is using briefs. So there is more chances of the urine coming in contact with the skin, and the skin integrity become impaired, and later on more problems can occur. Okay. Next case. A 60-year-old man is undergoing chemotherapy in your unit. He had 9 episodes of vomiting since yesterday. He voided once, dark amber clear unit. He states, "I just feel such terrible nausea and everything I look at makes me feel sick to my stomach." So what can be an actual and an at-risk diagnosis? So actual priority one is a patient priority could be impaired nutrition less than body requirement. And why we are saying that? Related to the 9 episode of vomiting, as evidenced by the urine dark amber, so it means a concentrated urine, and what the patient is stating. Another actual or priority could be nausea related to the chemotherapy treatment, as evidenced by the patient state, everything I look at makes me feel sick. So these are actual, so these are my priority. And what could be a possible goal for this priority? A goal could be a patient will be able to ingest a small portion of blend food every 2 hours and retain it in the next 24 hours. So here I know that this person is not able to eat properly and is nauseating. So blend food means no spices, no kind of like it doesn't have taste, but it's better in these cases. So he doesn't feel the nausea, and every 2 hours and retain it. So we don't want him to vomit again. So we can correct the impairment of nutrition and help with the nausea. Okay, what could be at risk diagnosis? He could be at risk for decreased urinary output related to the dark amber clear urine. So this patient goal, the goal for this at risk will be we need him to avoid at least 100 milliliter of urine per day. So this will be my goal. Or another at risk could be at risk for deficient fluid volume related to the 9 episodes of vomiting. So he is at risk for that because he is vomiting. So my goal will be for the patient to consume at least like 1,500 milliliter of fluids per day starting today. So we don't want him to be going into dehydration. So we want him to consume more fluid. So always, guys, remember when you are doing the during the nursing process, and when you have your concept map and you have your you want to find your nursing diagnosis applicable, and what is the goal and what's the goal and how to achieve it and intervention. So look, they have to be related. So your nursing diagnosis has. So what is this about? Is this about urine? Or is it about nutrition, or is this about what? And your goal should follow that, and your intervention should work towards this goal. Always make sure that they are related. Okay, and that's the end of our session today, and see you in the next recording.